In this video, I will be generating a tangent field and field breast plan using the Halcyon treatment unit and Eclipse planning system version 15.6. I first inserted a new plan and tagged it to the Halcyon treatment unit. I also selected the KV imaging for this treatment. So first I will set my beam arrangement. I'll go ahead and start with an angle and take a look at the beam's eye view. For the Halcyon treatment unit, you don't set a field size, you have the dual stacked MLCs. So all you have to do is select your gantry angle and collimator angle and then set your MLCs to a structure. So what I'll do is I'll take a look at the wires placed in simulation and find an angle so that they are intersecting, so that I have my tangential field that I will use for my two beams. And once I have my angle and collimator set, I can fit to structure, and I'll fit it to the target. And then I can also adjust my X2 here to include some flash. And once I'm happy with that angle, I can copy a pose. And I will just fit to structure again. Okay, I have my tangential fields, and I will go ahead and calculate. And I can take a look at the isodose lines, decide if we need to make any adjustments to the weighting. Next, I will start inserting my segments into each field. So what I'll do first is I will find an isodose line that I would like to reduce the global max by. Usually I like to go between 3 and 5% reduction from the global max. We are using version 15.6, and so we do have the dynamic flattening sequence with this Halcyon unit 2.0. This gives us a more uniform open field. So I'll adjust my isodose line so I can determine my first segment. My global max right now is 119%. So I'm looking at 115% in the red here. And that's about 4% reduction, and I'll go ahead and start with that segment. I'll highlight my medial tangent and select New Field and Field. I can select Interactive Apply, and then I'll highlight the MLCs that I want to move, and then create my new field border. I can adjust any MLCs needed. And then I will calculate. And I can adjust the weighting for that segment to reduce down that global max. I can also take a look at the DVHs and take a look at the target. With these segments, I want to pull in the tail of your curve without losing the coverage that you have. So that's another thing to keep an eye on when you're adding the weighting to your segments. Another thing to remember with these segments is to remove the dynamic flattening sequence from the segments. We do not need it flattened for these field and field segments. Okay, so now we brought it down to 115%, and let's go ahead and do the same for the lateral beam. Add a new field and field. And remove the flattening sequence. And then we can adjust our isodose lines. This is 113. And there's 112. We'll start there. I can select my MLCs and create my new block edge. If you see any MLCs that are red, you can go to this planning tab and you can verify MLC leaf positions. Calculate and adjust the weighting. Okay, and now we are at 110. Let's just look at our coverage here. This is 95% of the prescription. So at this point we can add another segment to each field to bring down that global max even more, and we can normalize if need be to meet our coverage goals. But for this purpose we'll stop here. So here is a tangent field and field breast plan using 6X FFF on the Halcyon treatment unit. Thank you for your time.